Are we live?
No, here, give it 2 seconds. Here you go.
Oh, wrong mouse.
Pink Table Talk is live.
Awesome. Hi, everyone. I'm very excited to do our third, really fourth Pink Table Talk. And today we are talking about getting to know our girls. We have some people kind of joining us over the next couple of minutes, but let's go all ahead and introduce ourselves and say maybe how you got, I was gonna say how you got into this work, but I really roped you guys all in. So, but I'm Haley Brown. I'm the Director of Programs and Partnerships for Touch the Black Breast Cancer Alliance. And we now have a new campaign for Love of My Girls, which is all about young women, for young women, breast health education, all of that good stuff. So this is our way of sharing that information with the blackdoctor.org Facebook community. Dr. Candace, you go.
Sure. Hello, everyone. I'm Dr. Candace Thompson. I'm a breast surgical oncologist. That means that I did general surgery training, and then I did a fellowship in breast surgical oncology. We're looking at the study of breast cancer in the surgery setting. And I practice at Stanford and mostly in the East Bay, so Emeryville and Pleasanton. And I'm really passionate about educating the community and just getting the word out there about Black breast cancer, because we know that it really affects us a lot. Happy to be part of this.
Sloan.
All right. Hello, I'm Sloan Cargill. Thank you, Haley, for the invitation to join. I am a director of annual giving at Howard University. And really this topic of being able to talk about why it's so important for us to be talking about breast cancer and talking about screenings early. It's really, close to my heart, working at a higher education institute and being surrounded by young women, young Black women at a HBCU. It's just such a conversation that we need to be having. I try to have that conversation with my friends. I'm excited to have the conversation with y'all today.
And Jalen.
Thank you so much for having me. I'm so grateful to be here today. I'm really excited for this conversation. I am Jalen Buxton Punch, from working in a classroom to consulting. I've done it all. I am now the founder and lead strategist of the Equitable Policy Collective. And I'm just really passionate about uplifting Black and marginalized voices and spaces in the nonprofit, education, and health sectors. So very excited to be having this discussion. It's really personal and near and dear to me. And on that note, I'm gonna pitch it off to Christine since she's joined us.
Perfect timing.
Hi. First off, y'all look so cute. Hello, glasses. Hells, yeah.
I'm wearing my mammogram sports bra too.
I love it. I got
Wow.
my sports gear on and just got from the gym. You know what I'm saying?
I'll send you one. I'll talk about our partners at Know Your Lemons. They have really, really great apparel, and this mammogram sports bra is great. I wear it.
It's cute.
Yeah.
And these glasses, it's giving what it's supposed to give. Hello.
Saturday was a night, but I'm here.
I love it. But hey, everybody, I am Christine. We're doing introductions. I'm the administrator, aka executive assistant, aka mama, but youngest person on the team for Touch. So I'm just happy to be here and ready to get to know my girls, because I love these babies. These are my best friends. So got to get to know them.
You have great girls. I would love
Let
them
me tell you. They're great.
Yeah, so guys, we are really, and this is really exciting for me because this is such a family conversation today. And I'm excited that we have Dr. Candace, who's here to actually show us and us and our family how to do self-breast exams and how to make sure that we are doing it correctly, know how to do it. And this is just good practice for us all. But first, I want to kind of get some information on why we started for Love of My Girls, right? Black women under 35 get breast cancer at 2 times the rate and die at 3 times the rate. And we're still not getting mammograms until we're 40. There are some conversations right now about that number being lowered or respecting anybody who comes in space. I'm asking for this kind of screening, but again, people don't know that that's a thing. So like we're still going to wait till 40, most of us. And we had to find a way to kind of bridge that gap between those numbers and mammogram guidelines. And 80% of abnormalities are actually found by doing self-breast exams. So this is something that like does work, which is great. And so I'm going to start by showing our little video. It's funny because Sloan's voice would have been in this video had we not gone to a interesting recording studio the first time. And so I'm going to go ahead and play this because I think it really just shows all the goodness about this campaign in a really succinct way. So check it out. This is our website, loveofmygirls.org. You can go to touchbbca.org and go to the Young Women tab as well. But here is a very fun way to describe this work.
Girl, 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 for the love of my girl.
Black women under 35 get breast cancer at 2 times the rate of white women.
And die at 3 times the rate.
It's up to us to take care of our girls.
The only solution is conversation.
I choose Black breast health because protecting my girls means protecting all Black girls.
I unlock my her story by talking with my family about our shared health history to know my personal risk.
I get to know my girls as an act of self-care. Are you ready to get in touch with your girls? Visit
loveofmygirls.org to get in touch with your girls.
What's actually really funny about that video is I did it with 2 of our old Howard interns, and we just have like such strong Howard representation today on this show. So yeah, that's really funny. But that's the video, and you kind of understand that we're taking a really fun approach to this whole conversation about cancer and making it a little less scary. Recently, my mom's been telling this story about when you find that you have cancer, you're just like in the dark. You don't know which way's up, and you're searching for a door that you just like literally can't find. And I think the idea behind this work that we're doing today and in this campaign is kind of all about how can we make that room a little less dark when someone is in that situation and they are in this moment. Like, how can we just provide a little bit more light, someone to grab your hand and or like get you to the door, and kind of again bridge that gap so young women do feel like they have the knowledge and the power to engage in doctors' conversations in a better, more intentional way. But again, this all starts with doing monthly getting to know your girls. And Dr. Candace, if you could all show us all now, I feel like we should all actively participate. Jalen, I know you're in this thing, but it's cool. We should all right now practice and do a self-breast exam.
Yes, so I'm going to start this off first by talking about a few statistics. So about 40% of breast cancers are found by self-palpation, and that's basically a woman found it by feeling in her own breast. She felt a lump, and then she goes to her doctor and then gets a mammogram and a workup. So 40% of cancers are found this way. That's not to say if you feel a lump, it's cancer. That just means a lot of cancers have been found this way. So it is very helpful. So if anyone tells you that it's not helpful, it is helpful, especially in populations, as Haley mentioned, who are not getting regular screening mammograms. So that's anyone under the age of 40 who doesn't have a mutation where we're typically screening those patients earlier because they have a mutation. But we're not screening patients if they don't have a mutation before the age of 40. So if you are 40 or older, I recommend annual mammograms, screening mammograms, in addition to self-breast exams. And if you're under the age of 40, then this is a good way to potentially catch something earlier because, as Haley mentioned, as African-American women, we are more likely to be diagnosed with breast cancer at early ages, unfortunately. So raise of hands, I guess, who here has performed a self-breast exam before? Oh, okay, that's great. Well, we're probably a little biased based off I have a poor population here, or a good population, but Haley, am I able to share my screen at all? I just wanted to go over like breast anatomy first before we go over breast.
Yeah, go for it.
Okay.
Should I just allow it?
Start broadcast. Okay. And it's on the wrong screen. Okay. Can you see this?
Yes. It says you are sharing screen.
Oh, it should be showing a picture. Okay. Let me try one more time. Sorry
Got
for
it.
each time. Start broadcast. Okay. Sharing screen.
There we go.
Okay. So let's go over the anatomy of the breast. I'm sorry, I couldn't find like a melanin, but it's fine. So this is what the outside of the breast looks like. We're all familiar with it. So you have your nipple, your areola, and then you have lymph nodes which drain the breast. And those lymph nodes are in the area called the axilla, which is the medical term for underneath the arm. So the picture over on the right sort of shows inside the breast. So the main purpose of the breast biologically is to store milk and provide milk for the baby. So you have the nipple, the ducts are all underneath there and they sort of branch out into lobules. And then you also have some fatty tissue around the breast, and underneath the breast is your pectoralis muscle and then your ribs. So whenever we are feeling in these areas, typically, as you notice on the picture on the right, there is a lot of tissue there between the muscle and the skin. So that's why whenever we're doing these breast exams, it's important to do them in 2 positions. So everyone who's watching, I want you to try to do this as long as you're in a private space where you're okay to do this. So this is from breastcancer.org. It has a really good step-by-step like pictograms on how to do these. So again, you want to do the breast exam in 2 positions. So typically upright, so either sitting upright, standing, or a lot of people will do it in the shower, just because there's a mirror there also. So it's important to look at everything. You want to look to see if there are any changes in the skin, any changes around the nipple. If the nipple is normally out and it starts going in, then that can be a sign that you need to talk with your doctor. If your nipples, some people have naturally inverted nipples, and if they're that way always, then that's your normal. So it's good to know what your baseline is. So you want to, when you're looking in the mirror, you want to have your hands on your hips and just take an assessment of everything. Take note of any dimpling that may be occurring within the breast, or tethering, or any sort of bulging. If there's any nipple discharge on, especially if it's on one side and not on both, then those can be things that you want to bring to the attention of your doctor. So hands on the hips first, take a look at everything, and then you raise your hands above your head and take a look at everything. And again, you want to notice if there's any sort of bulges or any dimpling. So then after this, you want to start to palpate around your breast. So we do these in 2 positions, upright and laying down. So let's go to the upright first. Typically, these diagrams will tell you to do it in a circular motion. The important thing is that you want to use the pads of your fingers and feel sort of using the pads, not too much using the tips like this, but more so the pads. And you want to have light, medium, and deep palpation so that you're really assessing the entire breast. Because as I showed you earlier, there's a lot of tissue here between the skin and the ribs. So you want to make sure you're feeling anything in the surface, in the middle, as well as deeper within the breast. So
Some of us have less tissue than others.
some of us have less tissue. others, and that's completely okay. The
Like
important,
I'm like looking at everyone here. I'm like, everyone here has boobs.
the
I was
important
actually wondering, is it harder if you have more breast tissue? Like I have dense boobs, I would say. And I always wonder, like, I feel like it's harder for me to get around. And I don't know if that's a thing.
yeah,
So
it can be hard. So you can use one hand to support the breast while you're doing this. This one doesn't have a good picture of it, but you can use one hand to support the breast while you're palpating all the way around. And you want to go from the clavicle all the way down to the underneath where the breast meets the abdomen. And then you want to go from the sternum or the chest bone all the way to the axilla or underneath your arm. And when you're feeling underneath your arm, it's important to feel there because that would be if there's anything. Sometimes people present with just a lump underneath their arm. So if you feel lumps there, then that can be a sign of something. Of note, though, if you get a COVID vaccine, then that can cause you to have some lumps underneath the arm. It's a known reaction from the COVID vaccine. And then, so again, you want to do light, medium, and deep palpation, assessing your entire breast as well as underneath the arm. And then you want to go to the other side also. Then for the second position, it's laying down. A lot of times women with larger breasts, it may be a little bit easier to perform these self-breast exams laying down just because you have gravity sort of helping to keep your breast in one position, and you can again use your other hand to move it around and make sure that you're getting all areas of the breast. And this is the position typically to be in when you're laying down in order to feel the whole area. Any questions so far about this?
No, I love it. I think it's just like, you know, a good reminder of like all the things, you know, mirror, the up to your lymph node, you know, just all those little pieces, because you might think you're doing it, but there are some nuances to doing it.
There are a few other things actually. So if you're menstruating, you should do these exams ideally like right after your period, not like leading up to it, because you can have hormone fluctuations, which can cause you to have, some people have naturally what we call lumpy breast or like fibrocystic breasts, which change a lot whenever your hormones fluctuate. So try to do your breast exam. We recommend once a month and around the same time each month. And then again, in those two positions and making sure that you're paying attention to any abnormalities that you see as well as feel. And remember underneath the arms. Yeah, Jay.
Would you suggest that we do like put it in our calendar? You know how we track our periods on like the health, like if you have an iPhone, it's like a health app, you can track your periods. So like a day or two after, would it be like helpful to say like check your period on, check your boobs on the calendar as well?
Exactly. Yeah, that's a great point, Christine. Yes. So definitely you can set a reminder every month to do it like the week after your period. And it's not something that has to be like, oh, I have to do this. It's just something to get acquainted with your body and get used to things. So
right.
It doesn't have to be scary.
I just threw into the Facebook, and I will put it here in the chat with us as well, the link to the Know Your Lemons app. So I'll talk about them later, but they have become an amazing partnership. I actually have my lemons here. These lemons literally come with a tumor inside, so you can feel this and then like feel like you can recognize something. And again, they also have these really fun mammogram sports bras, which I also think is like a really fun reminder. But their app will track your period. It won't take any other data though. Most of the period trackers take a bunch of data, and that's not how this app operates. But the app will very succinctly show you your period on like a monthly chart. And so you'll see when you should be checking your breasts on this app. And it also has the 12 signs of breast cancer. And again, everything they do is like really, really intentional. So the 12 signs of breast cancer are lemons in an egg carton. And you just like will remember that there are 12 signs because it's an egg carton, so they're just like very intentionally doing this work and making it so people can remember things. And so please download their app. It's been really awesome for me. Similar to us, we're trying to take out the scary and make this thing called cancer a little bit less scary by making things inviting and getting people doing things now. So check out their app. They're amazing. We love them. But Jill, your question.
I did. I also love their sports bra. So of course I'm checking out their app because it was the best Christmas gift ever.
Oh, yeah.
Shout out to Know Your Lemons sponsoring Christmas. So quick question, Dr. Candace, and it's a little bit about accessibility. For those of us who might have one hand or be down for whatever the reason, how do we get our partners and our loved ones to help us know our girls and to help us keep us safe? What are things that they should be looking for, or ways that we can help guide them in those changes monthly?
Yeah, great question. Especially like for those with disabilities, I guess, or who only can use one hand. So you can use one hand to check both breasts. It's okay. You don't have to have your hand over your head when you're checking that side. So it's okay to use both hands, especially because the main thing is to feel with the balls of your fingers more so than putting your hand above your head. So that's perfectly okay. And then as far as your partners go, there are a lot of women who come in because their partners have found something. So if your partner feels something, definitely like encourage them to say something. And then also the ways that they can help would just be any sort of changes that they see visually. Sometimes can be a sign of something. There can be like a little dimpling on like one side of the breast or one part of the breast that wasn't typically there. Sometimes whenever there's a mass, it can pull at the skin and cause this dimpling in like certain positions. So if they notice something that looks different, then and they say something, then you can feel yourself and see if there's anything and definitely tell your physician. And then there's one other thing I wanted to mention also. Here in the Bay Area, I'm partnered with Touch in Stanford. We're doing monthly seminars, and the first one is actually April 15th here. And part of those seminars, we will have breast models. They're like they're fake breasts that have masses in them, and they're connected to a computer system for anyone who comes to test out so they can practice doing self-breast exams, and they'll have like masses that are in there, and it'll tell you how accurate you were with examining the whole breast and finding the mass and everything. So that's really excited. I can put the link in the chat also for that.
Yeah, definitely. I think too, and Jalen's funny because I was like, initially when getting to this work, I was like, oh yeah, like partners should be checking boobs too. You know what I mean? It is now, I know, important to know your own normal as well. You can't just have your partners check. Because I was like, oh, this is a great like way to get this done. But no, you like everyone should know your normal, right? And I think they can be a part of that process, but you should know it as well. So kind of just want to shift the conversation into a space about like young women and Black breast health, but like health in general, because for example, the other day, the top of my abdomen was like randomly bothering me. I should have called you Dr. Candace, and I will now. Just for all my go-tos. No, but my stomach was hurting me, and I was talking to my mom, and it was like an intense pain for some reason. And my mom was like, go to the doctor, and it's just like, given the work that we do, you should go to the doctor. And in that moment, I'm thinking like, gosh, like even with all of the awareness and all of the things that I know, I still didn't want to go to the doctor. You know, like, how do I actually turn my awareness into action in a way that is meaningful and like gets done? Because I can be the most aware and still not do anything, you know? I'm thinking, like, what was I saying to myself? I was like, was it because I was like, oh, it'll go away? There was that thought was there. Let me just go get some probiotics. I'm not doing enough proactively here, so maybe it's there, you know? But like, again, all of my options were like, how can I solve this instead of seek a professional? And it's like, how do I make myself start seeking professionals? So I was wondering how you guys feel about that space. Are you similar to me, or are you someone that like does see something and goes to get it fixed immediately? I feel like Sloan, you are thinking about your ankle that one time. But it's just like, where are you guys in this moment where like I know the things, but am I acting on the things? And how can I hold myself accountable to doing that more often?
Haley, I'll just like jump in on this one because I've been thinking about this a lot lately. And as I'm like going to be turning 30 in the fall, and this whole year, I've just been like, I have to be on my like self-care. I have to like do all the things that I have like put off for, like grind culture and being like, oh, I just got to focus on working, focus on doing this stuff. It's like now I'm in this place where I'm like, I feel like I'm doing a lot of deferred maintenance, which is like a weird thing to think about in terms of like your own physical and mental and emotional health. But there were a lot of things. And even with like COVID, and I moved during COVID, and that like just became like its own excuse of, oh, I have to find a new doctor, oh, I have to go onto my online portal to like find one, see if they're like seeing new patients. I want to find a Black doctor, I want to find a Black woman doctor. And they always had all of these excuses. But over the last, I'd say like 5 to 6 months, I've been like really being very conscious about being like, okay, this is a part of investing in myself. This is a part of making sure that, if I want to go to like the next level of my life, I have to like do that for myself. And it's actually been like, I don't know why I was so stressed out about doing it, because now I have like this like great Black woman, primary care physician. I can just like send her messages, and it's been like the craziest. It's been just like the wildest thing to me, because I was like, I've had all these questions. I was using Dr. Google for all these years, thinking that like that's easier, but now I can just like at the tip of my hands like tell my doctor I have a concern. And I actually had my annual physical a few weeks ago, and now we're like, I said, I was like, I'm a little concerned about, I was like, I've had like aunt who passed from breast cancer at 35. She was like, we'll get you set up right now, like to go do these screenings. And I like, they're calling me every day so I can schedule it. I'll tell you when I get it scheduled and when I do the screenings. But like actually talking to my primary care physician and telling her that, she was like, we can just get you set up. It's not as hard as you're making it out to be. So that's something I'm focusing on. My deferred maintenance is what I'm calling it.
I hate when I procrastinate on something and then you do it and it was the easiest thing. You know what I mean? Like that happens all the time.
Great.
Yeah.
Sorry, you can go, Christine.
No, I said I feel that so much, Sloan. Like when I just moved to Florida, well, not just anymore. I gotta stop saying that. I moved to Florida almost a year ago, and I was literally stressed out. Like, oh my gosh, I gotta find a doctor. I gotta find this person. And just like you, Sloan, I'm like, I want a Black doctor because I want somebody that's gonna care for me and my health and know what's going on in my body. And it freaked me out so bad. To the point where I didn't go for like a while, and until I started like feeling pains like in my mouth, and then I started getting like extreme migraines. And just like you said, Sloan, like as soon as I went, it was like, oh, it's really not that deep. Like you will find what you need, and they will advocate. You have to, of course, advocate for yourself, but they will have your back when you finally go and show up at the doctor, right? I will also say another barrier that I had was like time. When I was teaching, I had a really great healthcare insurance, and I am blessed now to have a boss in like a company who cares about my health. And so I'm allowed to have another great health insurance. But time, I didn't realize how much time goes into all of that stuff. And so I didn't realize that that was a trauma that I was holding on to from teaching, because I'd be like, oh, I can't take off of work, or I can't, just say I need to go to the doctor if I'm having this ailment. So I'm just going to have to suck it up and deal with it. But now that I'm working at Touch, thank God, literally I'll hear like, did you go to the doctor? Or I'll hear one of my coworkers being like, or like Haley and Ricky be like, I went to the doctor, I have a doctor's appointment. And I'm like, it's 10 a.m. like, or it's 2 p.m. Like, you're not scared to take off work? Then I'm like, wait a minute, like, this is a part of life. Like, if I'm a human being, and like, I have to take care of my body in order to do the work, right? And so to see that it's a normal thing, I think that's another barrier for a lot of Black women in general. It's like, I can't take off work to go to the doctor. I can't just up and leave to go try and quote unquote do some self-care. I don't got that kind of time. And realizing now, like, if you don't advocate, it'll never get done. And I remember when I was teaching, like, I had to do that. It took like after 6 years for me to get to that point. But I remember being like, look, I need to go to the doctor. Like, I'm not feeling good. And so if it's in the middle of the day, y'all will figure it out. Like, because if I was to die tomorrow, you're going to have a new teacher in here tomorrow. You're going to have a new accountant in here the next day. So I need to figure out myself, right? And so I think self-advocacy is important, which is why I love, like, when we try, I love my girls. I love the campaigns, because it's like teaching me, a young woman, how to advocate for myself, because I now know what it feels like if I catch something. I now know my normal. And so if I'm outside of my normal, I can go into the doctor and be like, look, this is a little something going on. I need this fixed, right? So yeah.
On that note about just like also being too busy, I want to like really say, hey, all the young moms out there who are like, because I'm just like, I feel busy and I ain't got no kids. So like, I can only imagine what they're going through. And it's, I just feel like that it's really easy to like put off things that moment, because now you're taking your kids to the doctor. It's their experience, So I think we all need to realize that the world goes on without us, and we can go and take our time.
I really want to commend you too, especially on like finding a doctor and then following up on that, because that alone is like a huge task. I guess for the listeners, what did you use to find your doctor? Because that alone is very difficult for some people.
I actually use, I want to say, I always do check with my insurance first, because like, I don't want to like fall in love with the doctor and then get to the end of the portal and be like, oh, y'all don't take Anthem. Like, here we go. But once I did that, I checked with my portal, and then I actually use ZocDoc, which for years I've heard on I listened to the Read podcast. They always talk about ZocDoc, and I've heard it all the time. And then when I was like, maybe it'll work. And it did work. You can put in all the if you want to like people who speak different languages, you can actually put in those race filters, which sometimes I do find on the insurance website, sometimes they don't allow you to put in like a race filter. And like, I know that's important to like a lot of us. So ZocDoc, I actually do recommend it.
Yeah, I agree. ZocDoc, best friend. Like, especially when you're moving to a new location, that's amazing. You can find a therapist, you can find all kinds of doctors on there. Also, just like Sloan said, I do suggest starting with your insurance, because yes, ZocDoc, you can put your insurance in, but go on the website and see where like locations that your insurance does cover, because that is another barrier that we as Black women face. It's like our insurance is not covered in certain aspects. But also calling, that's something that's new to me. I never did it because I was like, they could just gonna keep calling my phone like a telemarketer if I don't set this appointment. But I realized calling in the office and being like, hey, I have such and such insurance, do you take it? Especially if it's one that I really want to go to, which was a therapist that I just signed up for. And I was like, I need to call because nobody's responding to me, not this, right? And so I was like, let me put on my big girl panties and let me call. And I called, got me a Black therapist. She's young, she's a Christian. And so I was like, look at that, me going out and making that phone call. And it wasn't that serious. It's never that serious. So also calling is another avenue.
Yeah, and to that end, Christine, I think what you're saying is so important about the barriers and flagging them, because it's not just, right, finding someone and making sure they take your insurance, right? It's being able to afford it. And I feel like cost is probably in the fear of cost, because having the anxiety of what you should be spending the money on, or if you should be saving it, or if it is serious enough, quote unquote. I think all of those things go into not just being younger, but kind of making decisions that are short term versus long term, because they're not beneficial, right? And so even this week, I was thinking to myself, rather than like the what if or the cost on the bad way, like what if this is nothing and I have spent the cost of x-rays and the copay for nothing. I was thinking to myself, what if on the good way, just like early detection, right? I am going in today has saved me a surgery or saved me, God forbid, a longer impairment or a ruining of the hot girl summer. I mean, you don't know. And we need to protect the girls of all of the body, all of the happiness. So I was very worried about cost, but there's also a culturally competent piece that I think everybody worries about with their provider. And I always like to remind people that like your providers know providers. So I've been seeing a Black female therapist for my whole life. It's been 20 years strong in the game of therapy over here. And I am a huge proponent of always asking, the last one or the next one, who would you recommend? Who do you really respect and admire? Who do you know of? And you'd be surprised that whether it comes from an orthopedist, right, or an oncologist, how many people respect, follow, research, and really revere one another in the field. So I feel like that's always really helpful for Black people in general to like say each other's names and put out who are you seeing and who am I seeing, like share that network almost.
I go to Christine's dentist. He saved my life.
And
like
sharing providers for a minute.
Yeah, you know what I mean? Like, yeah, no, I think that you can also on that same note is like go to trusted doctors to ask for other trusted doctors, but go to trusted friends and family also that you have in the space to like see things. I think I went through ZocDoc as well this past week. I think I have 3 tabs open currently. Because I too was like, where do I find Black close by, because I'm lazy, just like, the things that it mattered to me, I was big to be, and I live in DC, it shouldn't be that far to find a Black doctor. And it was still tricky, and I did make an appointment, so I'm happy about that. Because I think, Jalen, what you're talking about too is like, we fear all these things, and in that exact moment, we're like thinking about sick care, not health care, right? It's like, I've been really thinking a lot about that and thinking like America's sick care. This is not really healthcare. This is like we respond to things when we're not feeling well. When these things could be happen, you can get a checkup or these things so regularly. And then we have to be ready to combat that because we know that our healthcare system is what it is. We know in other countries it's healthcare, not sick care, which makes me so mad. It's like we have to move. But it's important to but yeah, like what are those fears? Like how do they get instilled, even though like I'm a capable, smart person and these things are still there, and I know that if they're there for me as somebody who does have access, what if you don't, and like what are those fears feel like? That must feel crazy, to like not even have internet access to go look up ZocDoc, like that moment alone.
I think
yeah.
Brought up a really big fear that people have is cost of everything. Despite having insurance, it may still cost a lot out of pocket to do certain things. But I think, especially bringing it back to breast health and breast cancer, if you wait until the mass is so large that it's taking over your breast, then that's going to cost you a lot more emotionally, physically, financially, than if when you first notice something, if you went in at that moment. So I think I know cost can be a trigger for people, but if back for breast cancer, if you do find something, the workup is covered by insurance in most cases to work up what's going on. So I would say that's definitely a component that people struggle with.
I mean, I know there was, sorry, Mom, but there was a year that I like didn't have healthcare. Yeah, I didn't have insurance. I just like was like, I'm this is the year that I'm just not going to get sick. Like I'm 25, I'm going to make it. But it was like, or maybe it was probably the first year I got kicked off my mom's insurance at 26. But you know what I mean? It was this moment of just like, I'm just going to wing it because right now this is not financially make sense for me to do. It didn't feel like it fit into the bucket of enough priority. It didn't feel like it fit into the bucket of enough time or money. You know, it just wasn't aligning with the situation. And I'm so thankful that year I did stay healthy and it wasn't an issue, but I could have gotten really complacent there. And I know that I could, you know what I mean? It's a space where you're just like, I'm fine, you know, in your mind, I'm fine, you know, and then it's like, it really, you know, it got me. The pandemic was like, okay, you got to get the good health insurance. Can't be scripting. I got to get the PPO now. but I think it's just, yeah, it's important to identify those barriers. And I think that For Love of My Girls campaign will continue to like work on being equitable across all those spaces and those barriers, because it's important to make sure that everyone feels like they are included here. And I do think that the work that we really want to do at Touch is to have like a solid Chrissy and Kip to and through model, because it's like, I can get you to the clinical trial, I can get you to the doctor, but like, are you seeing yourself through these experiences? Are you enjoying this experience? I feel like you should have a good relationship with your doctor, you know, and if you don't, then make a change there. But yeah. Do you guys feel like,
Sorry.
oh, sorry,
Yeah.
go ahead, Dr. Candace.
I was just gonna say, you touched on a good point about you need to have a good relationship with your doctor. I was gonna ask if anyone has like any history of bad relationships and what they did in those situations.
Yeah.
I've definitely had bad relationships. I think so. There's the healthcare industry can be, it's an industry. They're also like living, and it's something I don't think we talk about enough when we talk about like why people have fears of going to the doctor. Like for me, I live in a larger body, live in a plus size body, and like there is a lot of fat phobia in like the medical industry. And like it's one of those things where, you know, I have had anxieties about going to the doctor because like I had my appendix taken out a few years ago because I had I need to get an appendectomy. But outside of that, I've like historically I've had like just pretty much perfect health, like other than being in a larger body. And so it would always be like this annoying thing when I go to the doctor and it's like, okay, well, maybe I want to talk about this thing that's happening. And it always just goes back to, oh, well, you know, lose weight. And it's like, I don't know if losing weight is going to help me with X thing or that thing. And that is part of the, you know, those are realities. And I think that there are times for that conversation. And I'm not saying that there isn't an important conversation to have. We want everyone to be their healthiest self for themselves, of course. But we do also have to understand that that is a part of why some people do not go to the doctor. And when they have those, because it is hard to advocate for yourself. And like in my age now, I've gotten a lot better at advocating and saying like, okay, well, if this is of a concern, like tell me what are medical ways that we can treat this thing. And also let's worry about the thing that I'm worried about, or don't give me that added anxiety, right? But I think that it's a big part of why I think that is a part of why some people in certain bodies don't go to the doctor as often, or will defer and wait until it's like, oh, I can't avoid this. Now there is this huge lump in my breast that like, I've been feeling it, but I didn't want to go because if I go to the doctor, they're going to just be like, oh, well, you should lose weight. And maybe that's what the lump is.
I know. I remember seeing my BMI charts at my pediatrician as a child, and I remember always being in the overweight category, even though I was like, just like the song, just a little thick. Like it was like that moment, you know. And it's just like, why am I being made to feel like, we all know that test is not at all made for our bodies, period. But we know that now, you know, as a child, that was still a number that I like internalized in a way that probably wasn't healthy. And yeah, probably deterred me from seeking help all the time, when the first thing that you do is that moment, right? It's that moment, the first that you get there and you're dealing with that exact weighing or some, and it's just like now everything that we talk about is under that guise instead of having the other conversations that you want to have. So I think that's a really important point to bring up.
And to that end, I've been, as you know, I've been a size 2, I've been a size 18. So I have experience, and that is no exaggeration. That is
you
like
really have.
real talk. So I have experienced how I am treated and how the medical care or the narrative surrounding the medical care might shift depending on how I am presenting. I've also witnessed how regions can be a factor. So like Christine's in Florida right now in this call. And when we were going to a doctor in Atlanta, our experience was much different than when we lived in New Hampshire, and was going to physicians in New Hampshire. And so I think this conversation of like knowing your own body and knowing your girls and knowing how what your healthiness, like where that level is as an individual, and especially within a cultural context as perhaps a Black woman, it's really important because depending on where you are, whether that's New Hampshire, New York, DC, Atlanta, Orlando, the perception might change when you might be in the same body or the same, physical experience. So I think having the relationship that Dr. Candace was talking about, the relationship with the physician, is really important because your physician can kind of sometimes see beyond the chart, the BMI chart, or see beyond the rubric, or even how an anatomical skin is white, see beyond what anatomically is the standard. So I think it's just really, really important to remember that, unfortunately, Sloan, the fat phobia and the perceptions of Black women are really institutionalized, and self-advocacy and self-awareness kind of have to go hand in hand when having that healthiness conversation.
Yeah, and I also say, sorry, Hills, Jay, that I was blessed, grew up in 2 different households. I was blessed to be able, when I was with my mom, she was on it every 6 months, every 3 months, I would be in the doctor's office. And I remember that distinctly. I don't remember much from my childhood, but I do remember going to the local projects clinic and always getting a checkup. And that being the reason why I hated needles, because I was like, you're going to stick me. I know what this looks like. So I remember the routine. I knew the procedure. But then when I went into foster care and seeing how different it was for that family that I was living with, where they only went to the doctor because they were sick, right? Or something terrible was happening to them. And that I didn't realize that institutionalized a fear inside of me. I was starting to be so scared, oh my gosh, I can only go to the doctor when I'm sick. Mind you, I grew up going to the doctor regularly, right? But because I was in that household where they only went when they were sick, I started to have that fear. So I didn't even realize that we do it to ourselves, right? We pass that on to our kids, our family members, right? By only going when things are bad. And then I remember I had an instance in college at Howard when I literally was feeling so bad, and not physically bad, but mentally bad. And I was like, should I go to the doctor? Nothing's wrong with me physically, but mentally I'm not okay. Should I go to the doctor? And I was having an internal battle. And it took my best friend being like, girl, go, why wouldn't you go to the doctor? They can take care of your mental as well as your physical. Go to the doctor. You don't need to go only when you're sick. And I spoke with the doctor at Howard, and she literally was like, girl, you know that a lot of people can die because of mental that affects the physical. And so it took me learning that for me to get back into that routine where my mom had me on, with constantly going regularly and taking care of my body, not just when I feel sick, not just when I'm having an ailment, but going to know my normal, going so that the doctor can understand my normal as well. I realized that was really important. I was just thinking about this the other day when I went to my new primary care physician out here in Florida. And she was just like, oh, did you have a conversation with your primary care doctor about X, Y, and Z? And it dawned on me, I was like, wow, no, I don't do that. I don't talk to her. I'm in and out. Girl, hey, tell me what my results are and bye. Right. And so that was that relationship piece that I didn't know I needed with the primary care physicians. I need to talk to you. What does this mean? You telling me all this data about all these hemoglobins and all this stuff. What is that? I don't know what that means. I didn't go to medical school. Right. And so being able to have those conversations in the room with the doctor was really important as well.
Christine, you just brought up something really cool too. This whole concept of, we say knowing your normal in the breast cancer community. It's a really easy way to say, get to know your girls, right? but there's a knowing your normal of all of your things, right? Like I have a normal around like my mental stress does present as something physical, right? And so like I know I'm stressed when this happens, you know what I mean? So it's like knowing all of your normals, I think is important here, because then you're again going to be more equipped when you are having that conversation with your doctor. Which like kind of makes me think like if you guys did find something, like God forbid, you know what I mean? But like, and this is to the general public, but like if you did find something in your breast, do you think that you'd feel okay advocating for yourself in that moment? Like how, like if that were the moment that you were in, do you feel like you are somebody that can walk into the doctor's office and feel like you can empower, like feel like you can handle this conversation, you know what I mean? All the things, advocate for all the screening, I need this, I need that.
Yeah.
I feel like
Jayla, you want to go?
sorry, Sloan. Yeah, sure. I also feel like we should acknowledge that Haley's sample poll is totally biased. You know what I mean? Like she chose very strong, very empowered and opinionated and informed women. So I'll start there in acknowledging that. But I also feel like part of the backbone before my obvious yes is given, because it is a resounding and enthusiastic yes, I am flagging it. But I feel like the obvious backbone is because of actually you all on this call, right? I feel like if I were to find something, God forbid, or I were, even if I were to be concerned, let's say I didn't find anything, but it's just feeling different than it normally feels. And to soothe my own anxiety, I'm like, hey, it's my once a year mammogram anyway. Let's go and do the thing. I feel very supported because of the, and I'll use a Ricky term, the breasties community, right? Because of the network of women who are willing to talk about it and who are willing to physically and emotionally show up for each other. But I think more of those little pockets and networks should be built, right? I think it's on all of us to go and have this conversation with at least 5 or 6 of our friends who weren't here today. So that way, when they find something, they also feel as empowered, and there's kind of like that destigmatized domino effect. So sorry to cut you off, Sloan. Hit it.
No, I think that like Jalen, what you said is like very akin to what I was going to say in terms of, and what I think one of the we are in a space where like I think we have a lot of access and we are having the conversation. And I think another part of this space that is special, and you know, having known Ricky now for the, I don't know, last like almost decade of my life, knowing someone who is a survivor is a really important piece for me, because I think growing up, like being a kid of the 90s, like we would hear about breast cancer. Like my entire life, I've known of my aunt who died a month after me, but I knew after I was born. So like my entire life, I'd known about someone who died from breast cancer, but I didn't always have those stories of like people who were survivors and people who, you know, were able to like see something and then go through and do the treatment and do like get screenings and get health, and what does early detection look like. And like I think it's important that now we are hearing more of those stories. Now we have these communities where people who are can say like, you know, I went through it, you know, and because I detected it early, or even if I didn't detect it early, you know, science has come a long way than it was 30 years ago because of all of the investments in research. So actually like being able to have more people talk about, you know, that there are survivors, and like I think that is helping in like not lessening the fear, but removing that barrier of only thinking that there's only one outcome. Because for a long time it was, you heard the families of people that went through it, but not the people themselves that have gone through it. So that knowing survivors and having those conversations has been an important part of making me like, if I find something, I will go as quickly as I can, because I know that there is a chance that I can survive, and the chances are getting greater with every investment, every research, every conversation we have.
Yeah, Sloan, I agree. And that was my yes and no answer. Like my first answer was no, right? Even though I work in healthcare, right? I'm working in a space around advocacy, but I would say no. And that's primarily because speaking to breasties, when even if you are in medical field, you can be a doctor, you can be a nurse, right? But that instance of you finding out that you have cancer, right? It's scary. It's
And
like
then
your
it's
brain,
you. It's you
right,
now.
it's
Yeah.
me.
It's
It's like it's different. In that moment, I know I'm possibly like, and God forbid, right? I hope not, but I can tell based off of like how I handle stress now. It'd be something that would probably I'll shut down, right? And I probably wouldn't even think about the advocacy piece. But I think that goes to Sloan and Jay's piece around like knowing your community, who's in your circle, right? That's the importance of what we do here at Touch, is having people who can call. So I know I can call Ricky, I can call Haley, I can call Emily, I can call Dr. Candace, Dr. Mo, and be like, I don't know what to say right now. I know we did all these workshops. I went to SABCS. I did all the things, but my brain is not working right now. I literally shut down because I just found out something so detrimental to my health, life or death. But knowing your people, knowing your circle, so I know that I can depend on them. But will I honestly be able to say that I'm going to, in that moment, be able to advocate? No, like I'll probably shut down because I am so freaking scared. Like, you just told me that I might die, right? Even though I know that it's possible to survive. So,
So I think both of you brought up very important points about breast cancer and this history of breast cancer being a deadly disease not too long ago. But currently, the survival rates for breast cancer are over 90% for all stages. I'll just let that, over 90%. And if
that's
you
so great to hear.
Early breast cancer, then it's higher than that. So like we have really good treatments for this disease. So if that's why it's really important, if you feel something early on, to bring it up to someone. And as Christine mentioned, you may freeze. At least tell someone who's close to you, who you think can advocate for you, and bring them to your appointment with you so they can ask the questions if you're too much in shock to ask any questions. But the survival rates for breast cancer are so much better than they were in the past. African Americans do trail behind a little bit. As we mentioned, we do have higher mortality rates. We're about 40% more likely to die of breast cancer. But catching it earlier always helps.
Yeah, so interesting.
And Christine, I'm just going to volunteer Haley, in case you freeze, she's your emergency text person. I can attest that she is great. She'll pick you up, take you to Zaxby's. She's a great appointment buddy for all appointments.
For
you know
sure.
what I mean? There'll be food. So Christine, I volunteer Haley. That's how that goes. You know what I mean? I can do the before, she got the after. It's a shift system. You know what I mean? Sloan's on the next day lounge. It's how we roll. Don't worry, you can freeze. We still got your back though. Promise.
And I think that's important to note, right? It's like, because the reality is you might freeze, you might not freeze, right? And it's a beautiful thing to have people in your corner, people who are also going to hold you accountable, but also going to be there for you to help you get through that mental trauma that falls upon you, right? So it's a beautiful thing to say that, like, oh, I have this community, but the reality is not a lot of people have this community, right? And so that's why it's important, one, for us, I'm going right back to, our whole mission, to get to know, again, our normal, right? Because then that way you're in that room, and yes, you might freeze, but when you get out of it, you have the knowledge, okay, I have a higher chance of surviving at this point. So when I'm out of this freezing state, what is it that is going to take me to survive in this moment? Because you might not have that support. And I don't want to put it out there that like you're going to have a team of Haley's, Sloan's, Dr. Candace's, Ricky's, and Jay's, right? Because you might not. And it's important. That's why this work, and I love how Dr. Candace keeps saying early detection. That wasn't even something I knew about. I knew about breast cancer, right? I knew about the C word, but what the heck was early detection 2 years ago? I won't even say 5, right? What did that look like for me? But now that we know, as Black women, as Black men, we can survive this thing and catch it early. Why not do that work now? And so start advocating now before you have to find that lump, right? Go in and be like, okay, something just don't feel right. Not just with my boobs, but with my whole body, right? Go in and start advocating, because that's practice. For God forbid something big is to happen, you will have put yourself into that mode of being like, I'm going to self-advocate, period. Like,
yeah. And the other thing, I know this is geared towards younger women, but if anyone is watching who's over the age of 40, I highly recommend making sure you're getting annual mammograms at the age of 40 and not every other year. And also know your breast density. And if you do have on your mammogram, it says if you have heterogeneously dense or extremely dense breast tissue, especially for extremely dense, ask for at least a 3D mammogram. A lot of times I get breast MRIs on those patients because you're more likely to miss something on a mammogram in those situations.
Yeah, I think it's on us, to do the work. Christina really said, put on your big girl panties and do it. Like we just have to, that's where we are. It's like my mom would say, shit or get off the pot at this point. You know what I mean? Like that's where we are with this work. And I think we have to also pay it forward and like make sure that the next generation, like you're checking your girls when you get your period, like when that starts, that's an appropriate time to also add this into your education. You know what I mean? It just is. And that's why we focus on this age demographic, because the 18 to 35 year old can help the older generation and the younger generation. And that's what we really have to do. And yeah, so I just threw our survey into the blackdoctor.org as well. I was going to play my girl and have us all do it, but go do that on your own, because we are done for today. But please make sure that you are staying in touch with your girls. We have some really, really fun events coming up. We're skating in Chicago on April 1st. Come out and skate with us. Email us if you want to be on our newsletter so we can get you all that information. Doing an event at Dartmouth soon coming up. We will be at Pride in New York. Yeah, we just have a bunch of things coming up. So make sure to go to the website, check out the calendar, so you can stay in touch with your girls. And thank you guys all for being here today.
Thank you.
Thank you for having us. And thank you, Dr. Candace.
Of course, I'm happy.
She's so cool.
and she's hot. She's cute.
Right?
Warm. What?
Yes. Thank you guys for having me. And if you're in the Bay Area, please check out the link below and sign up for these monthly seminars. More education, free material. You can practice doing breast exams there, not on yourself, but on like a model.
And if you are in the Howard Network, we've got 3 beautiful Howard Network women here. So if you're in the area and just need that friend to take you somewhere, we're all not too far. So let us know. Thank you. Thank you, Black Doctors. See you guys on the last Sunday of every month. Next Pink Table Talk.
Woo.
Bye.
Bye.
Bye.